welcome everyone. All right. As I can see that more and more participants are joining, I think we'll get started. Before we begin, I would like to acknowledge the support of interpreters that are accompanying us throughout this webinar. So we have Hélène Besson for French, Miguel Sojo for Spanish, and Rachid Mtougi for Thank you for being with us, and I hope everyone, all the participants can have the chance to choose the language they would like to listen to this webinar in. All right, so good morning and good afternoon all, depending on where you're joining us from. Welcome to this exciting webinar on the Infant and Young Child Feeding Assessment Guide, and the topic being measuring progress to improve practice. My name is Dima, and I'm the Infant Feeding in Emergency coordinator. The webinar, as you would have noticed, is being recorded to make it available for everyone unable to join us today. Please feel free to introduce yourself in the chat and where you're listening in from. Just some housekeeping. It would be great if you can keep your mics and cameras off to save on bandwidth. And if you do have any questions about the presentations or questions for our presenters and panelists, please put them in the Q&A box, which is next to the globe icon at the bottom of your screen. We will ensure to take time throughout this webinar to answer the questions. Any outstanding ones will be answered after the webinar and shared with you all. For any other general comments or questions, these in the chat. So this webinar is jointly organized by the GNC, the Global Nutrition Cluster, the IFE Core Group, and more specifically, members of the webinar working group. You can see the logos on this slide, and the Nutrition Information Systems Working Group, as well as Action Against Hunger UK and FHI 360. I would like to thank our donors, also shown on this slide, without whom we wouldn't have been able to deliver the webinar. I also would like to take the opportunity to thank our colleague Miriam Yanakis from the GNC for all the technical support provided to make this webinar work. And so as I mentioned earlier, I work as a coordinator of the IFE Core Group, which is a global collaboration of agencies and individuals committed to the protection, promotion, and support of appropriate infant and young child feeding in emergencies, which we'll refer to in the webinar as IYCF-E. The QR code on this slide will take you to the resource page where you can find many IYCF-E resources developed by the IFE Core Group or members of the IFE Core Group, and they are available in various languages. So you'll find in French, Arabic, Spanish, and other languages as well. Oops. And then, as I mentioned earlier, this is a webinar that's jointly organized with the GNC Nutrition Information Systems Global Technical Working Group, and this QR will also take you to their dedicated webpage. And you can see here the Nutrition Information Systems Working Group is also composed of a number of organizations and agencies. And the Nutrition Information Systems in general is essential for improving nutritional security by monitoring program performance and delivering actionable data to guide effective and timely humanitarian responses. The NIS Global Technical Working Group strengthens global efforts by promoting practices, aligning initiatives, and fostering collaboration with key partners. Members of this Global Technical Working Group establish global standards for data, drive innovation through research, and provide rapid technical support during crises to teams. Together, members of the NIS Global Technical Working Group are ensuring nutrition information systems serve as a powerful tool to tackle today's nutrition challenges with impact and accountability. So on to today's webinar. We're really excited to be launching this new IYCF-E Assessment Guide today. We hope that throughout this webinar, we will be raising awareness on the importance of using appropriate methods and tools to help assess and measure IYCF-E and improve programming and support. We also hope to share experiences from country experts and colleagues. And so the way our webinar is going to look like, we will have two presentations on the IYCF-E Assessment Guide, followed by on the tool, and then we're going to go through a brief Mentimeter exercise on the use and dissemination of the IYCF-E Assessment Guide. And then we're going to move on to our interesting panel discussion that will be followed with questions and answers as well, and we'll close and evaluate. Briefly to introduce our presenters and panelists and facilitators for today's webinar, we have Alessandro Iayamo from FHI 360, Hauser from Action Against Hunger UK, Dr. Oleg Belucha from CDC USA, Solomon Atuman, FHI 360 Nigeria, Muhammad Ali Jatoy from the SMART Initiative at Action Against Hunger Canada, covering Asia region, Stanley Makaria Waweru from Action Against Hunger, based in Afghanistan, Brooke Bauer, Save the Children International, Rachel Menezes from Emergency Nutrition Network, Kirsten Kruger from FHI in the USA, Jodine Chase, Safely Fed Canada, Dr. Vindy Borg, independent IYCF practitioner and researcher, and Céline Delanger, UNICEF headquarters. And I will stop here and hand over Alexandra. I hope you all enjoy this webinar and off with our first presentation. Thank you for being with us.
Thank you very much, Dima, for this great introduction, and thank you all for joining us. I've heard that there's more than 1,000 people that registered for this webinar, so no pressure to us and the presenters. So what I want to start with to tell you about is want to be a little bit inspirational and tell you about basically a story of patience, persistence, and opportunities taken. And also because a big thing cannot happen alone, and you cannot achieve something big on your own. Also because everything happened because I worked with a person, a man, that wanted it even more than me. It's been 18 years that I'm waiting for this IYCF-E Assessment Guide. First, because I needed it first thing in the field, because I didn't know how to conduct it properly at the time. And then I felt the need when I became an advisor at global level, where I could see that the teams needed support that I couldn't give them because we didn't have consensus on what to use. So this is a little bit of the history of how 18 years of frustration got solved. Next slide. And yeah, it got solved thanks to somebody I was working with at Save the Children at the time. We were both colleagues, Alexandra Iayamo, when he was still in Save the Children at the time, conducted a mapping exercise in early 2021. Maybe some of you participated to it. And in this mapping exercise, we had quite a lot of respondents, 88 people responded, and more importantly, from 26 different countries. And the objective was mapping what were at the time the current practices on IYCF assessment methodologies. And as you can see on the graph on the right, the most common ones are mentioned. But apart from CAP surveys, SMART surveys, coverage assessments, strangely, that were used for it, there was really a large range of methodologies that were used for this. So next slide. So some main recommendations came from this mapping exercise. And first, the fact that there were so many methodologies really called to review and recommend a limited portfolio of those methodologies and making sure that they could be used at subnational and local level. And that, of course, there would be methodology that could be used for emergencies and humanitarian context. There was also clear recommendations on using IYCF indicators that would be more useful for emergency contexts, including the fact that at the time, the Global Nutrition Cluster I did some nutrition indicators registry, and that we could also use the indicators that were coming from the registry. There was obviously also a lot of recommendations regarding the sampling. And the fact that we were facing issues with people not sampling their surveyors in the same way, and therefore we couldn't compare different surveys, but also the problem of the size and the fact that the sampling size that were recommended at the time often meant that the assessment were not always feasible. And then there was also a need to review the progress and experience of the thresholds that were at the time indicated in the humanitarian needs assessment analysis tool, and recommending them, waiting for this guide to come out. Next slide. So from this mapping exercise, I think that's exactly when Alessandro could feel that there was somebody in the room that was as frustrated as he was. I'm an open book, so when I'm frustrated, people know. And so Alex came to meet me and say, like, why don't we do that together? Why don't we make it happen? So at the time, we knew that we didn't have any big donors identified. We knew that it's a project that would be a little bit costly because there was a lot of modules, and also because Alex and I have been in the field, having suffered from not having guides that sometimes were practical. We really wanted the process to be done in a way that the tools could be used by the people who are implementing the surveys. And when you do that, that means that you need to spend some time reviewing, asking people for feedback, and therefore at the beginning, with our scope of work, we decided to do a proposal with the full project, of having this guide using secondary data analysis, of having a guide looking at rapid assessments and qualitative assessment through key informant interviews and FGD, of having surveys and quantitative assessments, but also routing data and looking and helping people on how to analyze and interpret data, even though we knew that at the beginning we wouldn't be able to maybe fund the whole project itself, but we wanted the full project to be included in the proposal. Next slide. And so what happened is that this project happened in 2 phases. Well, 3, if you count actually the whole mapping exercise that was done in 2021. That was our first step because that was used a lot, obviously, to start the work. And during this mapping exercise, there was obviously also a lot of inputs from community of practice. And there were 2 groups at the global nutrition clusters that were interested by this work. And I think that's also a really good example of a collaboration between 2 working groups, the IFE core group and the Nutrition Information System working group, who both had this guide in their work plan and made it work together and jointly. And so I told you, we wrote a full proposal. We knew that at first we didn't have any donors identified, but we also knew that the Global Nutrition Cluster has some funding that they can allocate to develop guides or to develop tools that can be useful for the collective. So with Alex, we decided to get it started with the biggest priority. And then as we go with this project, to look for additional funding for the second phase. So thanks to the Global Nutrition Cluster, we built a task force and a group that would also input into the work. And we had a first phase where we developed 2 drafts of a module on IYCF surveys that would be nested into an upcoming survey, nested into a smart survey, and that's why our smart experts are on the call today, but also a quantitative assessment when you want to do an IYCF-E assessment as a standalone. And that's what we could find at the start with this seed fund from the Global Nutrition Cluster, with inputs from the task force at the time, which were composed of people from the AAH-UK core group and from the NIS working group. And then, luckily, our colleagues from USAID are part of this group, and they were also witnessing the need for this work. So thanks to them and to their interest into the project. We got a second part of the project funded to fund the full proposal, where we not only developed additional modules, so we changed the numbering of the modules, but we could then develop all the modules that were planned: the secondary data analysis, the rapid assessment, the qualitative one. And in addition to the quantitative that I mentioned, using program data and analyzing. But not only we developed that and we made those drafts, but we decided to have a process that usually we can't afford to when we develop guide, often because of lack of funding, to field test those guides, because it was really, really important for us and for the whole task force for these guides to be practical. So what we did is engage country offices and organizations that were about to conduct a survey, and we'll hear some of them during this webinar, and ask them for feedback on those drafts. Are they useful? What are the parts that are not clear? What do we need to rewrite? And this is how we came up with what Alex will now present to you, and we'll present you with the result of this persistence, patience, opportunity taking, and collaboration. Thanks, Alex.
Thank you, Alexandra, for your kind words. And this presentation will be done with the support and the leadership of one of the colleagues that has been very instrumental, Dr. Oleg. I will give the floor shortly to him to highlight one of the main components of this guide. But let me start once again thanking the donor, USAID, BHA, thanking FHI 360, Action Against Hunger, Alexandra. But maybe a couple of words also to highlight the many professionals that have been supporting all throughout this process. One of them, as I said, will present shortly, but we had several consultants. We had a very active and engaged advisory group with members from the two working groups, the IFE core group as well as the NIS working group. But again, maybe even a more special thanks to the country colleagues, as Alexandra mentioned, and to all of those that basically contributed to this very moment in the finalization of this comprehensive guide. Obviously, we don't have the time to look at every detail, but we'll try to give you a gist, a quick overview of what the guide is and how the guide can help our work. So next, please. So the guide is already available in several platforms. Links will be shared shortly. Next, please. So what's the purpose of the guide? It's really what Alexandra highlighted, is really to give us a more standardized way of assessing infant and young child feeding in emergencies, both at the national, subnational, and local levels. It should be helping us decide which one is the most appropriate methodology to use. It will help us decide what are the appropriate indicators. But even more importantly, or equally importantly, it will help us decide how to adapt it in the context we work. Next. The audience, and this has been one of the major efforts while developing this guidance, is really a diverse audience we are looking at. Obviously, we are looking at the more expert assessment colleagues. We're also looking at colleagues that may have some assessment understanding and background, but we hope the guidance will also be informative and useful to colleagues that don't have an assessment or data analysis background. So you see the effort was really to try to bring it to the to a vast and diverse audience. Next. As it has been mentioned, the guidance now contains 6 key modules, and Dr. Oleg shortly will highlight one of them, the quantitative. But you can see that the guidance will provide and provides tools, principles, steps on how to conduct secondary data analysis, rapid assessment, qualitative and quantitative assessments, and also to give us some tips and principles on how to use our existing program data. And equally important, again, is how do we synthesize, how do we analyze the information we are collecting? Next. Next. So, as I said, this is a guide. So while it does provide quite a large amount of reference and tools that can be used depending on the needs, but it really provides the set of principles that should help our teams decide, one, what information is needed. No, most of the time, or sometimes, let's say, we tend to keep collecting information, but it's not really what is needed, or it's not always the information that answer the needs. So one of the important questions that the guide is helping our teams answer is, what do we need? But also, and sometimes we tend to disregard, is what do we already have? And what are the gaps in the information that we need to fill? And eventually, how do we fill those gaps? So what is the right assessment? What is the right method that we need to use? Next. I will give quickly to some of the modules because I really want to give Dr. Oleg enough time. So if you just a snapshot of some of the modules. Next, let's look at the secondary data analysis. Basically, the secondary data analysis module provides some of the key steps on how to analyze information that are available either pre-crisis or during the crisis. Next. It provides a tool that can help consolidate, summarize, and analyze those information. Next. Let's look at the rapid assessments module. The rapid assessments module illustrates the different techniques that can be used when we want to conduct some rapid assessments, like observation methods, KIIs, or key informant interviews or focus group discussions, as well as proposes the tools that can be used and adapted. Next. At the same time, there is an effort to suggest when is the right time, and this is just an example, to use rapid assessment either at the rapid onset of an emergency or later on during the response. Next. And let me say this with the next module are really some of the most critical, we provide some of the most critical answers in relation to qualitative assessments. Next. The idea of the guide is really to provide the principles that can help us design and implement a robust qualitative assessment, but looking at again, at the context, at the timing, at the situation we are, at the resources we have. So you see, it provides guidance depending on how urgent is the assessment, what resources, what is the type of access. So you will see in the module this kind of considerations and the related relevant suggestion. Next. It also provides quite a strong evidence-based recommendation. How many FGDs do we need? How many KIIs do we need? And these are the questions we always ask ourselves. And I know also our colleagues are asking when we design or we add, for example, a qualitative component to our assessment. So there is the consultants, the teams, the advisory groups have done a great job in reviewing what is the available evidence and coming up with some strong recommendations that can be useful, that will be useful to our teams. Next. And I also wanted to highlight the experience. This way, for example, FHI 360 has been using the module as part of the testing, and currently is being using the modules in two major assessments, one in Yemen and one both ongoing, one in Yemen, one in Ukraine, on the qualitative side. One is to identify barriers and facilitators to accessing nutrition services. This is in the south of Yemen. And one that is starting really this week or early next week on determining what influence women's decision to breastfeed in a conflict like in Ukraine. So it was interesting to see how the tools were used to guide the design at the national level, at the local level. Next. I'll stop here, and I'm very glad that we have with us Dr. Oleg, but I will let him introduce himself and then do his presentation. Thank you all, and I will start again after Dr. Lorek's presentation. Over to you, Dr. Oleg.
Hello, colleagues. Can you hear me? Hello?
Yes, Dr. Oleg, we can hear you very well.
Okay, great. So very quickly, I wanted to give you some key pieces for thinking when you are trying to determine what information you need in this situation and what methods do you need to use to collect that information. Because historically, we saw in the field once and again, when people say, oh, we need IYCF information, this is an emergency, IYCF may be a problem, we need IYCF information, and people just go straight to saying, oh, we need IYCF survey. This is completely wrong, okay? Remember this. Quantitative IYCF survey is very difficult. It has a lot of limitations. And this is the reason why, when we were discussing at the beginning which modules should go into these guidelines, we said, no, not only IYCF survey, but there are plenty of other methods that often work better, give you more useful information, allow you to fill specific gaps in your context, and are cheaper and are quicker and allow you to intervene quicker with more relevant data, with more in-depth data. And that's why in these guidelines, we have secondary data, we have programmatic data, we have rapid assessment, we have in-depth qualitative assessment, and quantitative survey is only one of the possible methods, and I would say it's a last resort. So just to preempt, because we know that in several emergencies now people are saying, oh, we need IYCF information to act. So I would suggest that nutrition cluster in that country where you feel like you completely need new IYCF information, you contact what Alexandra and Alex described, our global nutrition information working group, and we can have like a consultation with you. I can come also in on that consultation, and we will start with what is your context, what is happening, what secondary data you have, what programmatic data you are receiving, what is it that's missing for you that you don't understand, and what that information gap, what would be the best method, the quickest, the cheapest, and also the most informative to fill that information gap. And quantitative survey is almost always not the best method. So I remember, the first big decision, like, do I need quantitative IYCF survey? Like in MIX and DHS, big surveys, they collect IYCF information. Collecting this in emergencies is very, very challenging. One, because it's very difficult to get enough children for different indicators. Like children 6 to 8 months, they are very rare in the community, and you need to go to a lot of households before you find all these children, and your confidence intervals will be wide because your number of children will be small, and they will not really provide you a good, reliable, stable estimate. Second, in emergencies, when we do surveys, we try to do surveys quickly and with good quality. The longer the survey, the lower the quality of the survey. So the problem is that IYCF questionnaire is very, very long. It has tens and tens of questions about different foods, about different drinks, about about the breastfeeding when they started, etc., etc. It's a very long questionnaire, so it's difficult to implement in emergencies. So the first stage should always be sitting down with the stakeholders, and we as experts would be able to help you and sit down with you to determine what data you already have. You always have a lot of secondary data because every country has mixed ODHS surveys that have been completed within like 2-3 years before emergency. So you already have all the information about why IYCF practices in the province that you are interested in. And IYCF practices, they don't change overnight. What you are really interested in, what IYCF practices are likely to change because of emergency. And that question is best answered in qualitative assessment, in rapid assessment, in focus groups, not in the quantitative survey, because quantitative survey may be unreliable. You will have small sample sizes, wide confidence intervals. So even if you get some numbers that are slightly different from what you had in mix and DHS, they may not be statistically significant because of the wide confidence intervals. So this first step is critical, and we insist that this takes place, this discussion takes place, which in our toolbox, as I said, our toolbox now is big. Secondary data, rapid assessment, qualitative assessment, program data, and quantitative survey, that we can sit down with you, understand your situation, understand the information you have, understand what is it that you are interested in that you don't understand, why you don't understand that, and then together deciding on the best method to fill that information gap. So if we went through this process and we decided, yes, maybe we still need the quantitative survey, there have been a lot of confusion. There was a CARE guidelines on how to do IYCF survey with huge sample sizes, 2,000-3,000 households, which are usually unfeasible in emergencies. So we are giving you a clear step-by-step decision algorithm where you decide what to do and how to do it most efficiently so that you get the best quality data that you need. So if we had this whole discussion and we said that, oh, we still need a quantitative representative survey of IYCF, there are two big options. One option, if there is a smart survey, because usually in emergencies, we try to do quickly smart survey on anthropometry in children to decide what is the wasting situation and what feeding programs we need to implement, how much, to what extent. So this first option, you just put your IYCF questionnaire in the smart survey. Smart survey sample size is not super big, but as you will see in the guidance, we described it to a great extent, to great detail. In the guidance, almost for all IYCF indicators, because we have like 15 or 16 IYCF indicators, and they are different because some indicator takes only children 6 to 8 months, like introduction of complementary foods. Some indicator can take 6 months of children from 0 to 6, exclusive breastfeeding, for example. And some indicator can take a lot of children from 0 to 24 months, for example, ever breastfed or early introduction of breastfeeding. So if you include IYCF questionnaire in the SMART survey, that's your easiest option. You may not get enough sample size for all of the indicators, but you will get enough sample size for almost all of the indicators with the precision at least plus minus 15%, which should be enough for you to interpret what is going on at the moment. Because this is much, much more efficient route than try to do another separate survey to measure IYCF specific. If you cannot include IYCF questionnaire in the SMART survey because there is no SMART survey plan for the nearest future, and you're saying, oh, no, I need quantitative IYCF survey as soon as possible, then it's the worst option. It's really the worst option because, as I said, proper IYCF survey in emergencies is very, very difficult. First of all, you need to go to a lot of households to find enough children for each IYCF indicator. As we said, like the main problem with IYCF indicators are narrow age ranges. So some IYCF indicators may only take children 3 months of age, 6 to 8 months, and some indicators can take 6 months of children. So it's very difficult to find enough of all these children to get enough precision for all these indicators. And this is easier in the settings where you have a lot of children, where birth rate is high, where percentage of young children in the population is high, where you have a lot of young children in the households. So basically, if you say that I am going to do my quantitative IYCF survey not attached to SMART survey, you will need to calculate. You will need to calculate how many children under 2 you can find per household, like to how many households you need to go to find at least one child 0 to 6 months, for to how many households you need to go to find the child 0 to 23 months, and that will be a large sample size, okay? And if you are trying to achieve at least plus minus 10% precision, you will need at least 400 children 0 to 23 months. So your sample size will be 3 times larger than if you were doing SMART survey based on anthropometry. So 400 to 600 to 800 children 0 to 23 months is a good sample size. And before even starting to think about the survey, you will need to sit down and calculate your demographics in the area and say, okay, if I need 400 children under 2, to how many households I need to go? If you need to go to 1,000 households, maybe it's still going to be feasible. But if you need to go to 5,000 households to find 400 children, like in Ukraine, for example, then it's not feasible. Okay, if in emergencies, you cannot allow yourself to go to 5,000 households. You better do some qualitative assessments, etc., to get that information. So in those situations where you see that to find 400 or 500 children under 2 creates completely unfeasible sample size in terms of households, like 3, 4, 5,000 that you cannot afford, then the last option, the last resort would be to say, no, I'm not going to go and randomly select households. I'm going to try to find some lists, maybe lists of registered for assistance, maybe lists of households registered with UNHCR or with IOM or with whatever NGO or Red Cross, for assistance. And then they give me the list. I filter, I find the households that have children under 2. I contact these households. I randomly select from the list that I have, and I will get these 400 children from the list. That's the most feasible option, like last resort option. Unfortunately, it has this limitation that is not going to be fully representative, because it's going to be representative only of children who are on the lists, of the households who are on the list. But usually these households who are on the lists, they are not super different from other households who are not on the list. So it's a trade-off between feasibility and your desire, your enthusiasm, kind of, to do quantitative assessment. So I'm going to finish here. You will get simple steps that I outlined at the beginning of the quantitative module. But my biggest message is that this process of IYCF assessment in emergency should start with sitting down and discussing all options available, what secondary information is available, what we think will be different because of emergency, what we don't understand, what is important for programming, and what is the best, cheapest, quickest, most informative method to fill that gap. And quantitative survey is almost never the optimal option. So I would suggest my last remark is that please, if you are trying to do this IYCF assessment, you need really, really fresh IYCF data in emergency, come to our NIS working group. We will have a dedicated pro bono consultation with you, have this discussion, what makes sense, what is feasible, what is not feasible, and how you can proceed. And only from that, I think we will start building like a library of case studies. Like in this country, we discussed, and actually this method, qualitative, was determined as the best method, and then we can document how it worked. Did it provide information or not? Instead of always saying, oh, no, I am going to quantitative survey. No, a quantitative survey is really a last resort. It's very, very tedious and difficult undertaking, and it should only be taken kind of judiciously only when we need it. And most often, other methods would work better. Over.
Thank you very much, Dr. Oleg. Yeah, very important guidance. And there is a very short and to the point summary that Dr. Oleg led in the development. So let me wrap it up so that we can move to the next session of this webinar. Module 6 is all about really helping consolidate and helping the teams analyze the information you are collecting, right? So it's really from conception, the way Dr. Ole was suggesting, to actually to the end, is really a teamwork where we try to utilize this information. So the guide is providing a simple tool, a simple matrix, as you can see here, that can help understand our sub-teams, like, for example, the various indicators. And based on the information we are collecting, we can agree on what is the situation, what are the trends, what are the barriers that the information collected suggest, what are the opportunities, as well as helping us triangulate any of our findings, both in terms of discrepancy or findings that are doubtful. Next. Quickly, there are some of the tools that may be helpful if you need more details, like, as I said, the analysis worksheet. Next. Or, and that may not, this may not be needed to all, but again, if you need details and if you need some more practice on how to estimate your sample size, Dr. Ole was very clear. We have some very clear guidance on this, but again, people feel free to use in case you need it. And this is all available in the guide. So this is the end of my presentation. The guide will be, the link to the guide will be shared shortly. Thanks, everyone. Thanks, everyone, once again. Over to you, Brooke.
Hi, everybody. We have just a couple of minutes now for some quick questions and answers. I see two within the Q&A box that perhaps we can answer now. currently emergency situations in Sudan are wars, displacement from one place to another. So how can the questionnaire be successful or useful, perhaps? Is there someone that might be able to take that question quickly?
Yeah, very quick. I hope I understood the question. But again, I think in situation like Sudan or in other similar situation, I think we need to be extremely pragmatic. And I think that was the message that we have just heard from Dr. Oleg. Let's really sit and discuss what information do we already have. And most likely there are information in Sudan that are very relevant and can guide the design of or can guide the ongoing response, and really decide what is the most pragmatic and efficient way. What is the method that we need to use to collect any potential relevant information for our nutrition response. So again, don't look at the survey or the quantitative assessment as the first option, but look at something very pragmatic, as it could be a qualitative assessment, as it could be a rapid assessment, as it could be reviewing the available data, because most of the time the available data tells the story. It can inform your work. Over. I don't know if Alexandra or Dr. Oleg wants to say more. Unfortunately, we don't have much time, but in case Alexandra or Oleg.
No, you covered it well, Alex.
Brooke.
Great. We'll continue. We have another Q&A session a little bit later as well that we can continue to cover these questions. Just also very quickly, one last one for this session. What's the recommended IYCF indicator to monitor regularly complementary feeding consumption in emergency contexts, and how regularly should it be measured? How often should it be measured? Alexandra or
Alexandra, you want to take this? Again, sorry, quickly, I think we need to be very clear what we're measuring. We have standard IYCF indicator for complementary feeding, but it's also very important to say that they don't change as fast as we think. So measuring them may not be the best way to understand potential gaps. So again, if you look at the guide, sorry if I'm quick in this answer, we are recommending some of the standard indicators, but also we are recommending to look at the indicators specific to emergency, like cross-sectoral indicators that may answer or may help guide our decisions, like access to general food distribution, or level of consumption, or coping mechanisms. There are other sectoral indicators that we highlight that can be very useful as to tell us what is the complementary, what is the potential impact of the emergency on complementary feeding. Over to you, Brooke.
Thanks so much, Alex. Please continue to put your questions in the Q&A box. I know Halu, our SMART colleague from ACF, put in a link to SMART Plus, which has an IYCF component, and he put that in the Q&A section. So if you're, I did see a question about that within the chat box, so please check that out, and we'll continue to answer these questions. We can go to the next slide. And then our question to all of you, if you can copy this QR code and answer in the Menti. Are we able to pull up that?
Just confirming, Brooke, is it fine for me to take that slide down? Would you like to present Menti now?
Let's give it a couple more seconds and then we'll switch over. So you can go to menti.com, enter this code 59294134, or copy the QR code. And Rachel just posted the link in the chat box. We have a couple of questions there that we would like to ask all of you on how you would be using this guide. Perhaps we can jump over, since that link is in the box now. Great, thanks. Oh, great, thanks very much. So who in your network would benefit most from learning about the guide? Examples could be government, agencies, cluster, national organizations. Others, continue to put your responses in there. I see a lot of the cluster, a lot of people working with the clusters and other NGOs. That's great. National organizations, IYCF specialists, governments, all nutrition actors, government agencies, national technical working groups for IYCF. Fantastic. Yeah. So understanding that working as that collaborative group, I see a lot of people talking about kind of working together with these different assessments. First responders, national agencies, great, all of the above. Wonderful. Survey coordinators, local government, fantastic. Great, thank you so much. We can go to the next one. So name one or two actions that you plan to integrate or you might be able to integrate the new IYCF-E assessment guide into your work. So in what ways do you see those ways to integrate this into what you're already doing? Thinking about that collaborative action with the assessments, thinking about ways to incorporate it into the work that we're already doing. If you're unable to reach Menti, please do feel free to put it in the chat as well. Great, capacity building, guideline consideration, future SMART surveys, evidence to influence methodology of assessments, great. Emergency assessments, fantastic. Capacity building, great. So qualitative assessments and explaining it to users. Integrate the qualitative assessment tools into the existing surveys, including indicators that are planned. Yeah. So goal, someone mentioned goal works across various countries, shared and considered for future assessments. Great. Meeting with cluster and capacity building of partners within countries. Integration of activities for the emergency situation. Yeah. Sharing it with practitioners to plan assessments. Great, so I see a lot of sharing, a lot of where many of you might be able to share it with the cluster, with other partners, provide that capacity building, strengthening our meal with our meal teams. Fantastic. This is really useful and great to see. Great, so please continue to put your Q&A in the chat as we continue the webinar, and we'll get to any additional questions. And thank you for your participation in the Menti. And over to you, Dima. Thanks very much.
Thank you very much, Brooke. And I will turn to Ray and Kirsten for the next section. Thank you.
Thanks all. I'll jump in. I'm Kirsten Kruger. I'm at FHI 360, and I have the pleasure of introducing this next section of the webinar, and we'll really spend most of the remainder of our webinar learning about experiences from folks who have tested out the guide and answering some of your questions. We've got a great collection of questions going, so please keep them coming. So first, I will ask our panelists to please introduce themselves, cameras on, and if you can share where you're working, where you're from, and then also a little bit about your experience in IYCF-E. So let me start with Muhammad Ali.
Hello everyone, my name is Muhammad Ali, and I'm Regional Smart Advisor with Global Smart Team at Action Against Hunger Canada. I'm based in Pakistan. Actually, I'm home-based. I'm looking after Asia region. So I've conducted few IYCF assessments that I will share my experience later when we have more questions about that. Thank you.
Thank you. And let's go next to Stanley Waweru.
Hi everyone, my name is Stanley Macharia Waweru. I'm the head of nutrition surveillance with Action Against Hunger Afghanistan mission. I've been involved in IYCF assessment. Currently, we are in the implementation phase, and the guideline helped us to from designing of ours is a standalone IYCF assessment, but using mixed method, whereby we are doing household survey and also focus group discussion and some of the key informant interview. So I will share that in the next phase. Thank you.
Thank you, Stanley. And next, let's go to Solomon Atuman.
Hi, everyone. I am Solomon Atuman. I am the nutrition coordinator with FHI 360. I am based in Northeast Nigeria, precisely Maiduguri. I have been involved in IYCF assessment as well as programming. For me, I think that is the balance. I am both an implementer as well as an assessment person. So the guide was very instrumental in the last mass survey we did, and it helped in both the design as well as more key in terms of the sampling of the participant. But I will be happy to share more of my experience in the Q&A session. Thank you.
Thank you, Solomon. Great. So we'll jump right in with questions. The first question I'm directing to Muhammad Ali, and the question is, when using the new IYCF-E assessment guide, what did you learn that you had not done before?
So I've been doing this IYCF assessment since last 10 to 12 years, but with IYCF assessment, like we were not having a kind of harmonized sampling methodology before for IYCF assessment, and while making comparisons or combinations of findings, it was quite challenging. But in this IYCF-E guideline, the sample size calculation procedure is more summarized, is summed up, and it is more uniformed. And also it provides you the detailed steps, as Dr. Oleg and Alessandro mentioned their email, that you need to decide while you are at the first stage or first module of secondary data, then you need to review and ask yourself that what exactly do you need, like determining the needs of information, that what information you have required. Then you identify the relevant data sources as well, and identify the information gap, that what exactly is required. And then you develop a plan, and then we decide that you are going for qualitative, quantitative, or rapid. And it also helps you to design the tools as well. So this information quite helpful in this guideline. And also when we are interpretation the result, it also gives a kind of reliable thresholds for breastfeeding indicators and complementary feeding indicators when it comes to results and all this. And also the other thing I want to mention about it also explains about the methods that we are going to use, qualitative and quantitative, within the assessment. And it gives kind of clearer idea and examples with advantages and also disadvantages that we are going to face in terms of results and findings. And it also gives us the sequence that when we are having a remote assistance, that how you are going to plan the training and step-by-step guideline throughout the implementation and the results interpretations. And it also explains, while there is a minimum representative of sample selection, of participants of different groups within the qualitative, as mentioned Alejandro in their presentation, that how many focus group discussions are exactly required, looking at the population, looking at the context. So this all information is quite helpful that we did not practice before in the previous surveys and IYCF assessments. And also it helps you to guide evaluation and detailed validity steps of the qualitative findings as well. So this is basically the combination of from planning to implementations and results, interpretations, how you are going to report it. So basically this was quite learning from this guideline. Thank you.
Thank you very much. Ray, shall I ask another panelist, or are we moving on?
Yes, I think we can move on, and maybe we could come back if we have additional time. Thanks, Kirsten, and thanks, Muhammad Ali, for your answer. It's interesting to hear about the learnings. Just to briefly introduce myself, my name is Rachel Menezes from the Emergency Nutrition Network, and I'm also supporting the facilitation of this session. So our next question is for Solomon. And the question is, what is your experience in ensuring IYCF-E assessments, standalone or integrated, are linked with good programming and community work?
Yeah, thank you so much. I think that is one area that has been very helpful for me because one, we have several reports disseminated. Without the use of that report in programming, it is quite difficult. So I have utilized IYCF assessment reports for one, targeted interventions. I'll give you an example. In one of the areas where we implement, you find that the rate of exclusive breastfeeding, for instance, is quite high, but early initiation is low. So it means there is a gap in that. So it helps you in having targeted information, targeted interventions for that particular IYCF indicator that is quite poor. So additionally, it also helps you in providing data-driven programming. One of the interventions that we've had that I can give a clear example of is in terms of the creation of father-to-father support groups here. We've realized that even though the mothers have learned the skill and the knowledge to implement IYCF practices, in this region, there are the fathers are the key decision makers in the home. So that has helped also in making sure in creation of the father-to-father support group that has bridged the gap between what the mothers know as well as what the fathers are implementing. I will also say that it also aids in our capacity building planning, where you have indicators that are quite poor, both for the local structures in the community as well as for the government and health workers. You tailor your capacity building sessions such that that area that is in need is improved. So apart from that, I would say one of that thing is that it helps in monitoring progress and making comparison. Dr. Oleg made mention of consulting secondary data. So without with this report, these reports now, you can make an analysis of whether you are making progress in terms of key indicators, or there have been a change in that indicator, and majorly what will have contributed to that change. So basically, those are some of my experience in implementing reports, IYCF assessment reports. Thank you.
Great. Thank you so much, Solomon, for sharing those experiences. I'd like to direct my next question to Stanley. So Stanley, what problems were solved for you by using the guide, and what did this guide allow you to do better? And what problems were you able to address with the guide? Thank you.
Thank you. Yes, this is linked to what Mohammed said. We had a fragmented approach, whereby, for example, when you come to sampling, we didn't have clear guidelines on how do you do sampling. how do you, the sampling parameters, and how do you use this? Now, with these guidelines, it's give you, for example, the sampling guide, because in Afghanistan, what we are doing is standalone, a primary quantitative, but it's a mixed method because we are also doing qualitative data collection method, focus group discussion, and the key informant. So we have been able to see how do we do both, including also collecting of secondary information that can guide in all of these. So now we have like this fragmented approach. Now we have one standardized way. And of course, it also helps us in stakeholder engagement. The guide gives, for example, how do you involve different stakeholders, including the community in, for example, the planning phase, in the piloting, and also in giving feedback after the results. So that's how it has been able to help us. We are in the implementation phase, and through it, now we have been able to conduct it in a better way, as opposed to when we were starting. When we were starting, that's when the guideline came in, and we had those discussions with the consultant, and through this now we have been able to document this, and we hope that we can be able to use this in the future assessment.
Great, thank you so much. I would like to ask Muhammad Ali and Solomon if you have any additional thoughts that you'd like to share briefly on this question before we move on to the next one. We have a little bit of time, so if you did want to add anything, please go ahead.
Yes, from my side, I think it solves a lot of problems when it comes to standalone IYCF-E assessments, when we have a lot of issues in terms of operational and logistical, or it requires sometimes massive resources. So while we are talking about nested or integrated with smart survey, so this guideline also gives us a kind of guide that how we are going to integrate IYCF-E and how we can get the representative sample. As it was mentioned in the earlier presentation, that with the precision of plus minus 15, then you can have some kind of idea. It is more recommended plus minus 10%, but with 15, you can also have some idea, and how many children you exactly required of different age groups. That can be also solved with this guideline when we are integrating. Otherwise, if you look at the IYCF-E assessment, it has a very narrow age range, means you need a large sample size and massive resources. So with this, I think we can have some idea, we can have some guideline to integrate that mostly people are interested, because looking at the current scenarios and resources and all these challenges, all the organization wants to conduct all the information within one kind of assessment to save the time and to save the resources. So this will give us a lot of relief. Thank you.
Yeah.
Great, thank you. Solomon, yes, please do go ahead.
All right, so I don't think we can emphasize enough the standardization of this assessment, how it has greatly helped us. You know, before now, everybody, I think every assessment, every researcher tried to do what he thinks is right. But with this, I think the fact that we have a standardized approach to IYCF-E assessment has been very, very helpful. But another thing I think I want to say is the fact that, you know, this is it is a bit flexible. It's flexible in the sense that it allows you to, even if it's not a standalone, you can integrate it into other forms of assessment. And what this does is that for us, it saves resources, but also it reduces, you know, respondent fatigue within the community. You have another, for instance, a food security assessment going on next week. Another person comes for IYCF assessment, so it reduces fatigue in the community in terms of responses. It also helps in, you know, bridging data gaps. Dr. Elek made very strong recommendation on the use of, you know, secondary data that are available. When you critically analyze all of the data available, you are able to see where there are gaps so that you can incorporate going forward. So I think that's just what I wanted to add in terms of that. Thank you.
Great, thank you for those additional thoughts. I'll pass over to you, Kirsten.
Thank you. So our next question will be directed to Stanley. And the question is, how do you ensure communities provide meaningful feedback and contributions as part of IYCF-E assessments? And how does the guide help us do that?
Thank you. I'll start by generally, and then comes to specifically to the guides, like how do we ensure meaningful community participation when we are doing IYCF-E assessment, based from my previous experience and then from this specific to the guide. So of course, active involvement of the community that is conducting participatory methods and also doing piloting of the tools. Not only the quantitative tools, for example, household survey, also the qualitative tools, for example, when you are conducting focus group discussions and the key informant interviews to ensure that, of course, they take the perception and the feedback from the community. Also using cultural relevance tools. For example, when you are asking foods in some contexts, there's this guide, the WHO guide that has questions on food groups that you should ask. In some culture, it's you can't ask some kind of foods, so you have to make sure that even the food listing is reflect the cultural relevance of that settings. Also, when you are doing after assessment, you have to do a very good feedback and integrations. So including a feedback loop where you share preliminary findings in the community feedbacks event that you may have. Then, of course, translation and back translation to ensure that diverse community members can engage with this process. Now, for the guide itself, and especially the qualitative model that I saw, it was very good. It's given, for example, how do we do community engagement? Okay, how to involve local stakeholder in every stage of the assessment, including tool for feedbacks and feedback documentation and analysis to ensure that the community contribution are systematically captured. And then, of course, it offers a very good practical guidance on overcoming barriers to participation. And these barriers can be barriers such as language, literacy, and of course, the gender dynamics. Thank you.
Thank you, Stanley. And maybe while we have you on camera and with your mic on, you could start with answering this next question, and would love to have all the panelists answer it very briefly. The question is what could you recommend to a person who is new to assessment or is new to using the guide to ensure a successful experience?
For some of the key things that you need to understand. First of all, you should understand the guide thoroughly. That is reviewing the guides to understand what, for example, what do you need to collect, for example. What kind of indicators do you need to collect? And that will guide you, for example, which model to use. You can do a separate like qualitative module alone, or you can do mixed when you have qualitative or qualitative. You can do rapid assessment, or you can do review of secondary information. Then, of course, start with a pilot. It helps a lot to understand, of course, how does this apply in your context, because application cannot be uniform in all the contexts. So in some of the contexts, you need to have make sure that some of the things have to be, in line with that context. For example, in the context of where I work in Afghanistan, we decided to go with female enumerators because we combine with the maternal questions. That is, we call it MIYCN, because we collect also maternal information like ANC and postnatal care. So those questions are sensitive in the local context here. So involving female enumerators. In some contexts, you can have both gender, female and male. Of course, it's also good to seek mentorship. We have like what Dr. Oleg said, like if you want to do a quantitative module, it's good to seek mentorship from the, for example, the information working group at country level, or the nutrition information working group at the GMC. So, and then of course you have to focus on objectives or be clear on what you want to achieve. Then the purpose, to avoid an unnecessary data collection. You may have some of the data existing. For example, in Afghanistan, we have another type of survey, and in that survey, it's collecting one exclusive breastfeeding in some of the provinces. So when we are doing collection of indicators, we don't collect exclusive breastfeeding. Now we go to other complementary feedings, including, for example, introduction of semi-solid food, minimum dietary diversity, minimum meal frequency, and minimum acceptable diet, because already we have another source of information. So you involve that duplication. So, and the other thing, engage stakeholder early. That is, of course, all the stakeholders, be it the information working group, be it, for example, if we're working in a consortium, the community and the local administration. Then, of course, use the templates. We have the standard questionnaire from the WHO guidelines, and also on the standard way you should ask for the food grouping and so on. And then, of course, the last one, which is very critical, is good to document the lesson learned. Reflect on each steps of the process. This helps you to identify what worked well, what did not work well, and what can be improved in future.
Excellent. Thank you. So many suggestions. Really appreciate hearing that. And our other panelists, Solomon and Mohammed, if you have something that's different from what we just heard, if you could unmute yourselves and add that.
Maybe just one, in addition to what he has stated, I will say start with what you have, basically in terms of review of secondary data. Like Dr. Oleg has stated, there is never no information. So start with what you have, review all of the secondary data available to you. That will guide what your next steps should be. And then it is important then to use the planning checklist. Very, very important to help you make sure that you have planned your survey very, very well. I think those are the additions I'll have. Thank you.
Excellent. Thank you. Anything to add, Mohammed?
I think it was explained well. It's only that person is new that at each step of this guideline reminds you to determine the needs. So then you decide. And also one other point that I wanted to mention, the ethical consideration when you are going for qualitative data, looking at the different cultures, different norms. So it's very important to consider this point as well. Thank you.
Fantastic. Thank you. Rachel.
Great. Thank you. Thanks all. So I know that the attendees for this webinar, some of them asked specific questions when they were filling out the registration form. And so we do have a couple of minutes. We'll be able to go through maybe one question, maybe two, depending on time. But I would just direct the first question towards you, Solomon, because we've highlighted a few of them that we think would be relevant for this Q&A panel. So Solomon, based on your experience, how do you ensure that assessments consider each implementing area's context and norms?
Okay, so I think in the last session, in terms of what you advise, it was stated clearly that you need to engage stakeholders early. I would say one of the key areas that you could do this is stakeholders engagement and participation from the planning of the survey or the assessments up to the implementation as well as the dissemination. That way there is a lot of ownership in terms of the whole process as well as the result of the assessment. Additionally, how you could improve in this is in terms of adaptation of the tools. I'll give you an example. If you take a standard tool for complementary feeding, if you're trying to get minimum meal diversity, you see that you see that there are several meals that are contextual for each region. So when you come, you have to contextualize that tool to reflect what is obtainable in that area. Another thing I want to say is in terms of know the dynamics of what is happening in that locality. Who are the power drivers? Who are the key decision makers in that area? That will influence a lot of how you would be able to contextualize your assessment in that area. So maybe to finalize this, I would say do a lot of training and capacity building for the data collectors and enumerators, such that they are able to reflect correctly what is what the true meaning of your tools are. It is one thing to have the right tool, but is if not properly conveyed, it may mean something else. Thank you.
Great, thank you so much, Solomon. Just based on time, I think we might have to wrap up this section of the Q&A. But thank you all, Solomon, Muhammad Ali, and to Stanley for your thoughtful answers and for sharing your experiences and expertise for this panel discussion today. We really appreciate that. And any questions that have not been answered will be answered after the webinar, and a Q&A document will be shared with all webinar attendees. So thank you all. And I will now pass to my colleague Hassan, who will take us through the next steps and closing out this webinar. Thank you.
Thank you very much, Dima. Colleagues, this was a really useful and really important step in providing a bit more clarity on the infant and young child feeding assessment. It's a big milestone in terms of getting the guidance out and having that available for field colleagues to be able to better understand when and what type of information is needed in relation to IYCF, but also how to maximize the different mechanisms and tools that are existing to be able to get the information that's necessary in the context of emergencies, but also in ensuring that there's a systematic way of reducing inclusion of indicators in places where they're not really able to get us the outcome and the input and the information and the quality that we need to make decisions. So I'm here because I'm representing Anseline, who's the chair of the Global Nutrition Information Working Group. I just want to highlight a few things before going to this particular slide. I think one of the take-home messages here is that now that the guidance is out, it's really important that there's a consistent understanding of how support can be provided. And the Global Nutrition Information Working Group is there to offer this support. As I think it was already mentioned, whenever there's lack of clarity or confusion on how to collect certain types of information, there is this mechanism available to be able to tap into and get really high quality, but also consensus-based technical guidance on how to collect information and data at field level. So it's really important that we tap into that. The Global Nutrition Cluster has established really clear mechanisms also for providing support. So if you're looking for support in nutrition emergencies and you want to be able to get either remote or in-country technical support, the GNC provides that. You want to hire consultants, there's a consultant roster that's available. You have small technical questions that you want technical advice. That's also part of what the Global Nutrition Cluster offers. And of course, there's the very robust and useful ENet space where we can have peer interactions. I'm sure all of you are already part of that. There is a QR code that's been provided here, so this will take you to the cluster website. There's a lot of resources there, including the guidance that's we just discussed now. Next slide. Yeah, and on the GNC website, there is a specific section where you can actually request for support. The form has been, in my opinion, quite simplified and quite clear. Please try to make use of this space. It's really a centralized mechanism to get you the response, the guidance, and direct you to the right people who would provide you the technical support that you need. So this is a space that sits deliberately within the cluster system, because that's where the coordination of all these efforts happen, and therefore it would be really important that we all tap into it and hopefully benefit from the cluster collective. And then finally, just to thank the organizers, the people who have worked really, really hard to get us here. Both Alexes, so Alessandro and Alex Pereira. The colleagues who are from the FHI 360, the IFE core group, the Nutrition Information Working Group, the global SMART teams, the Action Against Hunger, and the cluster team, for all the efforts that you've put towards getting us to where we are. We also have an evaluation that will take about 5 minutes. It will pop up when this webinar closes. So hopefully, please provide us your feedback, because it's really important for us to know what we can do better, what are the things that worked, and how we can improve for the next webinar. And on that note, thank you again, everybody, and have a good day, evening, wherever you are.